everybody. Thank you for joining Mask Live today. This is a day of technical difficulties, and we're just going to get through it. So thank you for joining us. Mask Live is our effort to reach out to experts to deliver you the information that you need and the access to, these experts to ask the questions that you have and sometimes are hard to get answered. So today we are going to be talking all about eating disorders and athletes. And I'm so excited to have Dr. Dena Cabrera on today. As I had shared, we have history. We have known each other since the existence of Mask, and Dena actually trained us in the very beginning with self-esteem and eating disorders. So very thankful to have her time today to tap into this very important topic. So Dena, welcome.
Thank you.
And I'm just so excited to talk with you because this is an important topic and we can never learn enough about it to help our children that may be dealing with stuff like this, and also looking at how as parents possibly we can contribute to the problem. So anyway, so what I always love to learn and have our families learn about is, how did you get into this line of work to begin with?
Sure. Well, thank you, Kimberly. I am a psychologist, but upon starting school, meaning going into college, I had come from a farming community, and where food was nutritious, but also was a young girl, obviously woman in this society that was influenced by dieting, the dieting culture, but also wanting to look a certain way and be accepted. I was a cheerleader. And so that was a big impact on my identity. And so when I went off to college, it was an eye-opening experience of trying to transition and find my own identity, but also still kind of stay in that body type as I was as a teenager. So that development and that growth was quite a transition for me. And so But in the meanwhile, I had two roommates who had eating disorders, and I had not really been exposed to specific. One had anorexia at two different times. One had anorexia, one had bulimia, and they were pretty severe in their eating disorder. So it was an eye-opening experience to see how people use food and used their bodies against themselves. And I was, alarmed, I was intrigued, I was afraid for them. And the actual truth is one has gone on to recover, very, very difficult recovery. And one, not at the time that I knew her, did pass away from her eating disorder. So it was when I heard that news, it became really real for me. And I knew I wanted to get involved in understanding eating disorders and how women and men in this culture are impacted and how dangerous they can actually be. It was just really a calling for me.
Wow, that is just devastating. And
yeah,
to be living in that environment with that had to be so difficult for you as well.
And yes, and living in the environment of really feeling helpless as a peer, which I would understand that many, I do understand many families feel that way as well. Many peers, many families, many people in their circle feel that way. They don't know what to do because it is such a secretive disorder, and it's hard to detect. It's hard to identify in a circle of other struggles that might look similar, such as anxiety or perfectionism, other issues like mood, depression. So a lot of that gets muddled, but I have some tips on how to kind of, sort that out. I've been working with eating disorders and families for over 21 years. So It's been a privilege and an honor to work with patients, and they've taught me a lot. So I'm hoping to be able to share that information today.
Oh, I can't wait to dive into that. So one of the things I wanted to start with is, as we kind of lay down the foundation of what we're going to be talking about today, is what are the differences between normal eating and actual and eating disorder?
That's a good question, because everybody has an opinion, right? And a definition and an input, and everybody has a reaction to food. I get on an airplane and sit next to one. As soon as they know, they have their opinions. And and we get lots of information, right? We have lots of information at our disposal to what, normal or healthy eating is. And my definition is really from a great resource for parents, especially for kids and children. Her name is Ellen Satter, and she's been a pioneer in this field, and she has a great definition of normal eating, and I'll paraphrase it for you. It really is eating when hungry, stopping when you're satisfied, eating with balance, variety, and moderation, paying time and attention into our nutrition and our choices, but also being flexible. And all of our nutrition choices or our approach to eating is going to be different depending on our activity, our response to food, our body, our hunger, our feelings. So sometimes, it's Thanksgiving, we may eat a little bit more, or, we're on vacation and we've been walking all day, and, we may eat less and have a bigger meal at dinner. This is what normal eating is when you take in flexibility. You might see a plate of cookies and, two cookies, and you might have one and leave the rest for later, or you might have both of them because you just feel like it. So it's really trying to understand that it is flexible. Where we get into trouble, like with disordered eating, and just because someone has disordered eating doesn't mean it's an eating disorder, but an eating disorder does involve disordered eating. Disordered eating are, where it gets to be a little problematic. Maybe there's different quirks, or there's different approaches you've taken to food. Maybe you've taken categories out, complete, categories out in your food. And it becomes a little disorder because it's impacting your functioning, or there's a lot of distress related to perhaps not doing your disordered eating. So for example, if you're at an airport and nothing's open and you're stressed out because you can't have a particular type of food, that could impact your nutrition, or you only want this brand. And I've seen this a lot with kids where they get particular on a particular brand, to the point that it causes nutritional deficiency. So that might be some examples. When we get into eating disorders, the two main functions, or two main areas, I should say, is the obsessionality around food, shape and weight, and the way it causes your functioning, and the way it causes impact into your functioning. So eating disorders, just to kind of review that, there's anorexia. There's, with this restriction of energy, so not getting enough energy to maintain what we would consider a healthy weight for you. Bulimia is the cycle between eating a lot of food in a short amount of time, and then using behaviors like laxatives or exercise or throwing up as a way to get rid of the food or the calories. And then binge eating particularly is consuming a lot of food in a short amount of time to the point where they feel out of control and just completely stuffed. But no compensatory behaviors. And then this last category, if you will, of food is called a short term for ARFID, which is these kids who have, it's avoidant restrictive food intake disorder. So they avoid or they restrict certain foods. They don't have body image issues, but they have picky eating or selective eating, or they have fear of eating. I've had kids who have vomiting, like fear of vomiting. So they restrict to the point that they're not getting nutrition that helps them stay healthy.
Wow.
Yeah.
That's
So
awful.
yeah. So it's really all about like how, I mean, with the patients that I work with eating disorders, they're consumed. And the lines between obsession and regular functioning, you know, especially as an athlete, as we talk about athletes, become blurred. But when it starts to impact their social life, their relationship with their families, their concentration or attention in school, their mood, then we start to see like, wow, this has gone beyond, you know, just kind of picky or kind of weird eating. This is really about them feeling that mental torture. Sometimes it's really mentally consuming that people can't see oftentimes, but they'll see it in other areas like mood. Yeah.
Well, we're going to definitely talk more about that because you had also mentioned kind of the other things, anxiety, depression, and all of that can kind of mirror kind of what they're going through. But I know the topic today, so we want to make sure that we stay kind of on the path on the athletes. And so let's kind of dive into that. One of the questions we had is, why might athletes be at risk for body image issues, disordered eating, or eating disorders?
That's a great question. And just to understand, you know, athlete, you know, being one who is in a competitive type of sport. So they're really have different personalities and goals and motives. I mean, we have our little kids, you know, that might be in soccer and they have little games and that's definitely, you know, that could be a factor. Nutrition is important, but I'm really kind of talking about, you know, athletes who are competing as part of an organized sport. And so their risk factors are really the same as our other children or other people might be, is dieting, the pressure to be thin, low self-esteem is definitely a factor, and anxiety. There's a strong genetic predisposition that may be involved as well. I mean, genes don't necessarily determine fate, but it could be something that you know, is a factor. So it's genes and environment. But within the sports world, within athletes, there tends to be a belief that decreasing your weight or body fat will enhance your performance. Right. And so that's a big risk factor that, well, if I lose weight, then I'm going to perform better. And initially, somebody might. You know, they may perform better, but in the long run, what is going to be the impact on their bodies may be detrimental. The other aspect of why athletes are at risk is body image issues. So we have particular stereotypes of what a basketball player looks like, or what a diver looks like, what a gymnast looks like. And so oftentimes they feel that pressure to look a certain way. I've worked with gymnasts who are getting tall, you know, and so for their sport, they feel like, well, I'm supposed to be short and petite. This is an issue. But maybe if I'm thinner and I start to restrict, I'll fit into that sport. And so there's body image issues that can be really detrimental, particularly with the aesthetic sports where they have to wear a particular uniform, a bathing suit, a leotard, or for men, you know, in sports with their little bathing suits, bikinis as divers. I know people have walked out. I know an athlete who would walk out to the pool, and the first thing he's thinking is, do they think I'm fat? You know, so it becomes very obsessional in how their sport is revealed. So that can be a big issue. The last just point as far as risk factor is going through, and I kind of mentioned that, going through the transitional period in their sport developmentally. So how their bodies look at 12, at 14, at 18 are going to be different. And so I think that can be a risk factor of hormonally, nutritional needs are different, and certainly conditioning and training needs will be different as it relates to nutrition. So I think that those are some things to kind of keep in mind.
Think about it, like as parents, we always want to learn to do better, to change what we maybe were modeled, right? And so I just think about looking back as a parent, through all of our kids and all of the activities. And it's like, in elementary years, like at the baseball games, you're always cupcakes or donuts or all of these like sweet treats that really are not in line with the activity. And so those are just things that come to mind that we can be contributing to the issue.
I definitely think in the way we experience our own bodies as parents, the way we message that to our children, one of the best advices that I try to give to myself and to my families is don't disparage your own body. Don't disparage anybody else's. Don't make comments about, oh, wow, that person lost so much weight, because our children are listening. And so that might be internalized negatively, like, oh, I should be losing weight. Like losing weight is a good thing. And not necessarily, so to them and their sport, and that's where we have to really balance it out, conditioning, nutritional needs within their sport, as well as the messaging, the mindset of, what is healthy doesn't necessarily equate with performance. So that's something to think about.
Well, and this is just kind of going off a little bit, but I just think as a society, when it comes to a lot of different things like health checkups, you go and take your child in for a health checkup and they do the height, weight, and then they tell the kid in the room, oh, you're at the 50%, or 80 or 90. And it's like that messaging, they're labeling them at that point, either saying I'm normal, I'm too fat, right?
Yes.
That needs to change. Like
so that is a great example, because that exactly happened to me. It's happened to a few of my I call them patients or clients. That's happened to my own kid. My 16-year-old who's going through a growth spurt went into the doctor, and he said for height he was in his 50th percentile, and then for weight he was in his 80th or 90th, and he interpreted that as being fat. It's exactly what he did. And so as a parent, I really had to give education. You also have a lot of muscle mass. So when we're looking at that formula, those numbers, it's not an accurate depiction of your genetics. First of all, that's a whole other issue of looking at BMI. It's problematic, muscle mass to height and weight. So that's an issue. But I had to give the education of when people are with lot of muscle and they may not be as tall, it is going to look different. They don't take into account those issues. So it's your body. The numbers do not tell the story because they're not based in, normality. They were used, long ago, 50 years ago.
I know it comes back to what they're hearing. And if they're hearing little messages from all these different things that, oh, I'm not in this perfect box.
Right.
So that's a lot of undoing we have to try as parents to redirect them to think that, no, that is such old thinking. Like you can't, I mean, I've had that happen with my own kids, and I was so angry, like when I left, because you can tell like within that doctor's appointment what they feel like. You see their body language and you're just like, how dare you? This
right.
Is so shame on you. So
but I think that's a great point in talking with doctors knowing ahead of time, like, I know this is a wellness checkup. I want to be mindful of not sharing these numbers. We talk about these things differently in our house. Going to coaches and being mindful. Like, I know, particularly between eating disorders and those with athletes, they're amazing. It's hard to tell what is an eating disorder type of perfectionistic profile versus a really good athlete, because they're perfectionistic, they're compliant, they want to do their best, they want to please, they have high pain tolerance. So I think as parents, it's a really good, like, yeah, I hear that she's performing well or he's doing well, but I see also that there's difficulties and distress around it, particularly around weight. So I think it's our really due diligence to be able to talk to coaches and talk to doctors and providers about, like, this is the dangers of you focusing on their weight. I have one kiddo who, is in dance, and they go to take measurements for their recital costumes, and their measurements are yelled out, 25, and it's so humiliating and devastating to her. And it just really, like, I'm bigger than everybody else, whatever they make out of it, whatever the truth is, like, they might be the smallest one in the room. It doesn't matter. They feel humiliated and shamed and embarrassed. And I think we have to remember, that can be impactful.
Right, for sure. The next question, why might an athlete with an eating disorder look ideal to coaches?
Oh, kind of similar to what I was talking about with those, not all the time, but a lot, those with eating disorders have different type of approaches to to sports. In the sports, the identification for, like, a coach or a parent is kind of what I said. Athletes and coaches, draw the line. They have to balance the line between physically fit and conditioned, maintaining peak performance, and then the obsessions and compulsions around that, the training, the nutrition, all that's involved. I mean, if you take someone who's well known, like Michael Phelps, his training and condition and his nutritional daily regimen was pretty strict. I mean, he had to get enough, and that's under the guides of a whole team. So it's just with, like, any other athlete, they have to be really mindful of the nutrition that they're receiving to have peak performance. But it can get really slippery. How much do you, just like someone with diabetes who has to pay a lot of attention to their food, they can get really obsessive about that, and it can become disordered and rigid, and it could impact their nutritional it can impact nutritional deficiency. So those are some things that we have to be careful. The thing about it too is coaches, with those with eating disorder, there's a fine line between perfectionism and pursuit of excellence. There's a fine line between unselfishness in their sport, doing it for the team, and selflessness. A lot of people with, struggle with eating disorders, if they're giving up themselves and don't have boundaries and don't have a balance between stress, meaning their sport of training, and rest, they can really find themselves in a depleted situation. So that with parents, that's one thing I always emphasize, with ourselves, are we balancing, our productivity, our achievements with rest? Some of the best athletes know how to do that, particularly as it pertains to stress on their bodies.
What are special treatment components for athletes that need to be considered?
The multidisciplinary team, a psychologist, therapist, dietitian, a coach who really kind of understands the demands and pressures of the sport, and the demands and pressure of the nutritional needs, and the mental support. So I think having a multidisciplinary team, working with different providers in their specialty areas, but then also keeping in mind that treatment needs to have that understanding of having two body images, one in the sport and one in outside the sport. I had a patient that she was muscular and strong and fit well in her sport, and yet when she would wear regular clothes outside of her sport in society, didn't feel like she felt, met the appearance ideal, the thin ideal. And so she really struggled with balancing that out. So, and then also understanding that they do well in therapy in the sense if they're motivated to get back to their sport. So they're very motivated. But that being said, they want to rush through it. They want to check all the boxes. And we have to understand that it's a process. It's a process to work on these things.
Right. And the thing is, too, it's like they want to get back to that. They have that passion, because we talk a lot about having kids find their passion, because that will always get them back on track. And so for the kids that are struggling with eating disorders, especially in sports, they have that pull to get better.
Yes.
So,
and another thing that's kind of interesting that you made me think of is I'm working with a few kids, adolescents that are, and I've worked with actually a college student who did not want to be in their sport. But for various reasons, they felt compelled, the pressure with their family, the scholarship that they are receiving to go to school and participate in their school. So there was a big conflict between, hating it, really, hating the pressure, hating the training, not being committed, and feeling like they have to do it. And that's something I think we might want to recognize, as parents, like, even though they have talent or they were made for this or they're good at it, because they've got the mental focus but they don't like it. Like, we really need to kind of negotiate that within ourselves oftentimes as parents. Right. I mean, how many of us have talented children that don't want to use their talents, because they're not passionate about it.
For sure. We did an issue, years ago. It was a competitive issue. And one of the articles was like, whose dream is it anyways? Because, so many parents want their kids to live out maybe what they didn't live out. And so they're putting that pressure on their kids. And it's just not fair,
Right. And the message is, don't put it to waste. You got talent. This is good for you. It's mental toughness. It's a really hard balance to negotiate that. At the end of the day, I keep reminding myself as a mom, they're on their own journey. Yes. Like, this is their own journey. Like, we have, right?
Yes. We can do a whole episode on just that.
Yes. I have to every day. He's on his own journey. I just keep saying that.
Let's try to stay on the ride.
Right. I mean, every once in a while I have to pull out the, okay, I got leverage here. I got to use it. But at the most, it's not my vision and idea for their path. We can help guide and help motivate, but at the end of the day, if they're really conflicted, it's something to pay attention to.
I've got to get out of the way.
Yeah.
So on that, how do we raise healthy athletes?
Oh my goodness. I think, first of all, in all of what I've talked about today, I want to know that I love sports. I love working with athletes. I think sports are a great outlet. And I think, having that discussion that we've been talking about, how our changing bodies are part of this process. I think that's one. Be a critical role as a parent in their sports family, not too overbearing, but enough to, have some understanding in the messages that they might be receiving from coaches. from their doctors, like we talked about earlier, because coaches play a big role in their life. And I think it is extremely important to say, look, she has a propensity, he has a propensity, they have a propensity to be obsessive about food or nutrition or about, and it gets to the point that they tend to over exercise. So having that knowledge for coaches and being aware of those issues is important. And there is a lot of resources, in raising healthy athletes for coaches. In fact, on the National Eating Disorder Association, on that website, there's a whole, do I have it here? There's a whole kit for a whole toolkit for coaches on eating disorders at each level, at each grade. So there's the younger grades. And so it's called, can you see it? Oh, you can't really see it. The Coach and Athlete Tool Trainer. I'm not sure if you can see it, but, and it's free to download and it's a great resource. And so as parents, having the conversation, your body's changing, being mindful about nutrition, being mindful about your own messages that we might be sending that might be negative about our own bodies or others' bodies.
Absolutely. Well, I mean, that is, as parents modeling it, the messaging is definitely how we talk about ourselves, how we talk about food, how we label food,
Yes.
name around food. All we, we can contribute if we're not aware. Well, we're going to take a break now. And when we come back, we're going to talk deeper just about eating disorders and also, how social media has influenced it, what the warning signs are, how do we know our kid may be going down an unhealthy eating path, and what we can do to help them internally and when to seek help. So if you want to watch this full episode, it will be available on the Mask Matters app. You can get that on Apple and Google Play. It's free, and there is a library of information for you and your families. So download the app and join us for the next episode.